I'm going to turn back to our medical oncologist. This is an interesting case, and I wonder how often this happens or if you've encountered this. A patient is newly diagnosed. They test positive for two major molecular changes. So they have a classical EGFR exon 19 deletion, and they've got an ALK fusion. What is the current standard of advice for starting treatment? Do you start treating one mutation first or alteration first and then switch to another? Do you combine things? What does the latest research suggest in terms of the best treatment plan?
So I would have to say that I think that this is probably a very rare occurrence. I know we see a lot of compound EGFR mutations where we might have two different EGFR mutations in patients. Again, something that's rare. I don't think that there's a standard of care here, right? I think we would be looking at, what is the variable allelic frequency? Like how prominent is that ALK fusion in comparison to the EGFR mutation to help us decide which treatment are we going to start with. I do think that, there could be considerations of combining treatments, but I do think that we have to keep in mind the toxicities and how this has not been tested and not standard of care.
Dr.
I
Ruiz?
agree. So, first of all, I would confirm the presence of two mutations. So, either by sending ctDNA and or repeating a biopsy to confirm. I haven't seen a de novo or like a patient who's newly diagnosed with these two alterations. However, I've seen cases, or maybe I can't say cases, maybe case one or two maximum cases of persistence in an EGFR patient, and then an ALK fusion was quote unquote the resistance mechanism. I've seen patients being treated with a combination of osimertinib and alectinib. Some patients had to dose reduce one or two of these compounds, and yeah, and the results were really good. So I think we need to know what is the stage of that patient, and then number two, confirm, and then number three, if it's de novo versus a progression on a single targeted therapy, but combination has been used before.